Okay, so here we have a patient that has been in a motor vehicle accident about a year ago. Pretty severe accident, heavy collision. All the bones in her sternum were broken and the ribs were broken, and was hit so hard, in fact, that the seatbelt broke all of those bones, but she also broke this bone right off at the back. The head was whipped forward so far and backwards. Now, she's got a lot of arthritis in here, in her neck, and this disc where, explain to them, the disc where the bone is that was broken is been also quite damaged also here. But the main problem that she's now experiencing, other than residual pain in those areas, is hip pain. Literally in the hip. Let's see where the hip pain is. I would show it to us.
No alguses mul oli kõik siin, pärast pani siia kubemesse, aga nüüd lööb siia nagu kõik.
Aga kus see nagu hakkas või kus see kõige hullem koht on?
No hakkaski siit, niisugune tunne oli, et siin oli mul rõngas peal nagu valutas kõik.
Most painful is this area.
Ma täitsa lankasin.
So she's got she's got some arthritis in these hips and in the bones in here, but the whole pelvis is not straight. The pelvis is, kind of tilted. The two pieces are actually not even completely, not totally correct, right at the pelvis, right here. But the spacing is not too bad still in the hip joints, so hopefully we can help her with that condition. It doesn't look like she needs a hip replacement or anything like that. So you can see that she walks with a limp. Okay, now, no pain really?
Valus ei ole kuskilt?
Hästi natuke siit oli.
A little bit.
Vot nüüd on siin valus.
Okay. So this one is definitely not coming up as far as the other one. See the difference there in that hip joint. Was this hip, this is coming down a lot farther. Was this hip bothering her like after the accident? Do you think this was a result of the accident? Does she feel this was a result of the accident?
Peale seda õnnetust või enne?
Ta nagu õrnalt mulle andis kunagi tunda, aga niisugust ei olnud nagu ta praegu teeb.
Pigem ikka peale õnnetust.
No, it's going down slowly.
Accident.
Bone in there. There were some breaks in here I could see as well, but they're healed. So the main thing is her hip, right? So let's look at the length here. Come over here and let's look at the length of this. Now she feels that it's long. She feels that it's short on the left. Is that what she feels? What does she feel?
Kas sa tunned, et vasak jalg on nagu lühem või?
Siis kui ma tahan sirgelt seisa, siis tundub jah, et vasem on pikem.
Left is longer.
Yeah, a little bit longer. A little bit longer. What if we're going to fix that up for her?
Doktor.
Wow. Hoia tõesti? Hoia? A lot of people would not be that.
Doktor ei suuda imestada, et tegelikult on olukord päris hea, nii peale nii rasket.
Siin oli natuke valus siin.
Natukene, jah. Hoia tõesti?
Vot nüüd peab siia.
Teise poole?
Teine jalg.
Hoia? Okay, so we need to strengthen that. Mark it in blue. That left hamstring is a little bit on the weak side. This contracted quadriceps is sending signals to the hamstring, telling it to relax all the time. That's why it's weaker than the other side. Alright, so what you're going to do is hold the hips down for me. All I have to do is change the way these muscles are working. I'm pulling on the pelvis and it should change. This muscle that's short in the front, it goes into the joint. It actually attaches inside the joint. So it's going to affect the joint. It's how it feels. I'm going to lengthen this so she breathes in through the nose and stomach and then lengthens.
Lööd võsta, hinga nina kaudu sisse. ja suu kaudu välja.
Lõdvaks.
Tagasi.
Lõdvaks.
Lase lõdvaks. Tagasi.
Hästi lõdvaks. Suru.
Suru.
Lõdvaks. Lõdvaks.
Lase lõdvaks.
Uuesti. Uuesti. Breathe in.
Hinga nina kaudu sisse.
Breathe out.
Suu kaudu välja ja suru jalga doktori poole.
Suru minu poole, suru tugevasti.
Tugevalt suru.
Suru minu poole, suru.
Suru üles seda nagu põlve.
Lõdvaks. Lõdvaks. Uuesti. Lõdvaks. Aha. It's 90%, 80-90% better looking now. Little bit, but much better. Palju parem. Ei ole 100%, aga palju parem. So there you have it. We can go over those muscles afterwards and what we did there to get her to walk again properly. But suffice to say that this was a good example of a hip injury where the patient wasn't walking properly and she basically limped in and leaped out. So it's another Trigenics success story. This is Dr. O and the Dr. O Show. Thanks a lot for watching our Trigenics video today. Make sure that you subscribe to the Trigenics YouTube channel so that you're always sent information on the latest Trigenics techniques and methods, as well as the latest Trigenics success stories. This is Dr. O and the Dr. O Show.